Welcome to COVID Talks. We will have a second look now on Africa, and I have the pleasure to have with me Dr. Jacquelin Kitulu from Nairobi, the capital of Kenya. Dr. Kitulu is a family physician in Nairobi, and she is at the same time the president of the Kenyan Medical Association. Welcome, Dr. Kitulu.
Thank you, Ma.
Dr. Kitulu, when we look at the numbers for the COVID cases in Kenya and in the surrounding countries, the numbers are actually very low so far. For Kenya, that's as of today 208 cases that have been confirmed. Unfortunately, 9 people have died so far. Nevertheless, a lot of voices say this can get very difficult in Africa, and everybody raises concerns about the healthcare systems in Africa and the possible outbreak of COVID-19 in the countries. And as far as I understood, you are now for a number of days already in a lockdown, which actually with a curfew during night, which is imposed on the population and which is enforced very rigidly in your country. So how is the situation now in your country, in Nairobi and in Kenya in general?
There are several measures that have been put in place. I'll start by saying it's not a lockdown, it's a lock-in. And that's a lock-in in 4 specific areas, which were hotspots, one of them being Nairobi, which is the capital. So it's not a full-on lockdown around the whole country, but literally locking in travel in and out of the specific hotspots. Now, one of the measures that was taken actually, which seemed drastic at the point when it was initiated, was the mandatory quarantine for all passengers who came in. So our borders were closed, so no flights in and out, but those that came in on the last flights had a 14-day mandatory quarantine period that was imposed on them. So of course this appeared very harsh, considering people coming from far away and coming home and yet couldn't get home. But from managing, so I have been seated at the quarantine and isolation facilities command center for the last 2 weeks. And that has turned out, I think, to have been a blessing, really, in the sense that the majority of the cases that have been picked have actually been picked from the mandatory quarantine centers. And now when you look at it, and I think that if those passengers had all gone to their various homes and various cities around the country, we would have literally had community spread at a very high level. So the mandatory quarantine period is coming to an end. There's several who have finished their time and have been able to go home after testing. So I think that has had one major impact, difficult as it may have been. But moving from that, really, there's lots of efforts which are being managed at multiple levels, right from the Ministry of Health and inter-ministerial teams working on ensuring that there are resources that are needed for the various stages, for the tracing, needed for the contact tracing, for the testing, for maintaining the isolation quarantine facilities, mapping out where isolation facilities will lie. But at this point in time, the priority being the testing. So testing is being scaled up. We have started with initially we had very few kits. There's more that have come in. And I think you've already seen our numbers. We've tested about 8,100 people so far. But now that the mandatory quarantine stage for the travelers who had come in, that has exited, because those were about 2,600. We'll now, the target now is to do large-scale testing. And of course, that may bring up a very different picture. You've said the numbers seem very low right now. And indeed, with the scaling up of the testing, we don't know what those figures will look like. But looking at the modeling and what had been projected, they had projected a lot more cases by now, which hasn't happened. But we are still working with various models, and with those, setting out priorities in what will be required. Of course, as in many African countries and in sub-Saharan countries, our hospitals, health systems are in many ways not as sturdy as health systems in Europe and the US, where we see them struggling, and yet they are not at the level where we are. But even with that, we have set out as a country, mapping out areas that generally dividing the country into regions so that you can have what will be technically COVID hospitals, so that ensuring that they'll have the infrastructure, the human resources, again, which is an area where there's a major shortage. So there's an app, actually, in the last 3 days, there was an advert put out to recruit human resources, doctors, nurses, laboratory technologists, and all. I mean, all that are needed to ensure that the infrastructure that has been mapped out will have the matching need of healthcare workers. So, so that whole process is ongoing, and mapping out within each county what will be, say, the regional COVID hospital, and then surrounding county hospitals where those with milder symptoms may be taken to, and then a third ring around that would be non-healthcare facilities that can be, which can, with a little tweaking, can be turned into isolation or quarantine centers for those who turn positive and are not able to quarantine at home. You realize many of our families live in smaller places, and basically the idea of self-quarantine can be a challenge, which we are realizing even now with even just saying self-distancing and social distancing, and that there are challenges in that. If you have a small home, a 2-room house, and you have 3, 4, 5 people in there, how much distance can you put between them? So being cognizant of that, then around the counties, mapping out such regions. And what we have decided, what has been picked up is the use of schools as non-healthcare facilities, which can, with a little tweaking, can be turned into quarantine centers. These are because they already have all the existing infrastructure, many of the boarding schools. So they have kitchens, they have laundries, they have rooms. And so together with the Ministry of Public Works, the chief architect, the biomedical engineers, looking at some of those places that if what tweaking would be needed to turn them into quarantine facilities, if oxygen needed to be added to those, and if there was an overflow past the hospitals, then those can be used. So there's quite a lot going on in those areas. Along with that, then is also the issue of ramping up the testing, which is in the general public, but then also for healthcare workers. That has been a challenge because it was something which has come up, especially the testing for healthcare workers, because as a country, I think we're not an exception, and we've been seeing countries around the world, they're all struggling with the availability of PPE. Is not enough. So, and what is the risk that we are putting our healthcare workers to when there's not enough PPE? So that has been a big challenge, getting adequate PPE, because even on the international market, there isn't. I mean, there are funds, but there's nothing to buy. So one of the efforts which the private sector has done through our association of Kenya Association of Manufacturers was to get now local production ongoing. We have factories in what we call our export processing zone, where they usually do a lot of textile work, which for export. So those factories have been ramped up to start making the surgical masks, the hazmat suits, and all those were taken through a process of accreditation and assessment via Kenya Bureau of Standards. There are companies that have passed the standard test, and those then, so the idea now is to ramp up the production of that. And we're looking at production of even up to 40 million masks a week. So we are hoping that will at least will curb part of the challenges that we are facing. Of course, as beyond that, the government is also still looking at in terms of buying from out there, what is available, the masks, generally the PPE. The other areas in terms of the ventilators, of course, as a country, when you're now looking at the point of if you're going to deal with critically ill patients, where are we going to take them? And in terms of our capacity, we have probably just about 500 ICU beds countrywide, which is a very small number. And of course, ICU beds have to go in line with ICU nurses, ICU doctors. The numbers are few. So, but even in terms of prepping those up, that if we do have critically ill patients, there's procurement for ventilators, which is going on. World Bank is supporting that. But even as we discuss that, perhaps the critical care team are saying the provision of oxygen might be even a greater priority, even before we come to the ventilator. Assuring that each of the hospital facilities has oxygen, the necessary piping, and things that will be needed. Those are some of the priority areas that are being looked at.
You gave already a pretty good tour de raison with the situation now. Do you think that has any influence now on the investment in the healthcare system for the future? Has there been now a higher awareness of how important it is to have the health facilities running and being capable and resilient to such a pandemic?
Actually, that if one may look at it as maybe a bright side of in this very dark time, is that it has brought to the awareness of the policymakers the need to strengthen the health system. In the past, we've always gone on that we don't have enough health professionals on site, we don't have enough nurses, we don't have enough doctors, we don't have enough of so many different cadres of health professionals. And it was never really looked at as a priority, but right now it is a major priority. One of the ads that has gone out from our Public Service Commission, it's looking at employing anesthesiologists, medical officers, nurses, the whole works. So that has come out. The other is in terms of the infrastructure, the present infrastructure in terms of the hospital facilities. As we've gone around and looking at mapping hospitals that could, that would be COVID hospitals, so to speak, we've noticed the challenge in terms of what is available. So many of them need a lot of ramping up in terms of just even the basics that are available there. So I think this is one point that I think we are hoping that post-COVID-19 will come out with stronger health systems.
In many of the European countries where we see, and the US as well, where we see that distancing is one of the measures that seems to help to flatten the curve, not to stop the pandemic, but at least to flatten the curve. We have learned that distancing is very difficult. Even so, in most of the European countries and in the US, people have ample space. Now, looking to Nairobi and many of the quarters in the town where people are living extremely densely, is that something that also is being now considered as a problem? And do people talk about putting more efforts in improving the living standards for people in the country there?
Well, indeed, that has come out as a major, major challenge, and there are efforts that have been are being made to try and ensure that it will be maintained to a great extent in public areas. So one of the measures that was made was to close, restaurants, so you can't go and sit in a restaurant. Only takeaway places are open. But even transport, let's talk about starting even from transport, that majority of the people use public transport. We have small minibuses, which we call matatus, and they're also the bigger buses. So even in those ones, the number of people they carry has been reduced. So the little minibuses usually have 14 people. The maximum number now has been reduced to 8 people as an effort at social distancing. That's on the public front side, and in facilities, people being advised to keep a distance and stay away from, but even that is difficult. When you move further into now, like if you move into the high density areas, you realize then that the houses are literally one next to each other. The population is very high. So then the idea of social distancing, it becomes almost practically impossible.
Yeah.
You can say that if you live in a big house, but when you're moving further into high density areas, it's almost impossible. So if you're going to say, for example, that you're going to lock down completely, then how do you get food to there? And in this past week, a group of people said they would provide food in one of those areas, and it was absolutely chaotic because everybody needed to get food. Now that people have been encouraged to work from home, less people going into offices and all, there are people whose bread and butter is their daily work. They have to go to work every day. So the fact that many businesses have scaled down the number of people at work, it means there are people who have no income. So if you say you will avail food, then everybody will scramble for it. So I think managing the dynamics of how you'll avail the food, and then also reducing time in the offices, because that's a big issue. That's now with people being encouraged to work from home. If your job is a laborer, you can't work from home. You need to go out and do whatever it is that you do.
Dr. Kitulu, let's hope that the numbers stay low in Africa and that you go through this pandemic without major fallouts. We will probably have a chance to have a second talk after some time and see how the situation has developed and how far the projections have become true or not. But for now, thank you very much for this talk and have a good evening.
Good evening. Bye-bye.